Have you ever wondered if Tamiflu actually works in preventing or treating the flu? Well, stay tuned to find out. How's it going, guys? My name is Edgy Edge, and I'm currently a fourth-year pharmacy student, and I enjoy making these videos about common questions patients have about medications or any pharmacy-related topics, so make sure you subscribe for more content. Now to the rest of the video. Tamiflu is an antiviral medication. Antiviral meaning antivirus. And we know that the flu is commonly caused by a virus. So a lot of patients do take Tamiflu when they do get the flu or they think they have the symptoms of the flu. So how does Tamiflu work? Tamiflu works by inhibiting the enzyme neuraminidase. Neuraminase's normal function is to cause replication of these flu virus cells. And so the more flu cells you have in your body, the harder it is for your immune system to fight off these cells. And so by taking Tamiflu, it inhibits this enzyme neuraminidase and inhibits this process of replication. So you have less flu viruses in your body. So either your immune system can either prevent the flu or help treat it much faster. So now the big question is, does Tamiflu actually work in preventing or treating the flu? The answer is yes, if taken properly. So how do you take Tamiflu properly? Well, the recommendation for Tamiflu is that you have to take it within the first 48 hours or 2 days of having symptoms of the flu. You don't necessarily have to have the flu per se. You can have the symptoms of the flu, and it helps maybe prevent actually getting the flu, even though you were supposed to. Or if you do have the flu, it's going to help you recover much faster. Now, if it's been after 48 hours, it's not as effective compared to the first 48 hours. The reason being is probably what we discussed about before, is how like the viruses have multiplied so much that you're gonna have the flu regardless. But another study has shown that if you take Tamiflu after 48 hours, then you have a recovery time decrease of 24 hours. So you basically get better a day faster, if anything, when you take Tamiflu after 48 hours. But the general rule of recommendation is within the first 48 hours. Now, there's one caveat I want to talk about, is that Tamiflu is not an over-the-counter medication, meaning you just go to your local pharmacy and pick up the medication. It has to be a prescription. Now, you have to then decide, and also your doctor, about the kind of cost versus benefit analysis of, hey, do I have to make an appointment with my doctor or go to urgent care to get a prescription for Tamiflu, then go to a pharmacy and fill it. So patients generally have a copay when it comes to visiting a doctor, and also a possible copay when picking the medication up at the pharmacy. And also the time of going there versus you resting. That's a decision you and your doctor have to make, but I'm just kind of trying to put this into perspective for you guys to understand of how this medication works and how you might go about to get this medication. However, there are some exceptions to that rule. So there are certain patient populations, typically for those who are immunocompromised, meaning their immune system is not working as normally as they should. These patients, it is recommended for them to still get Tamiflu even if it's been after 48 hours of having the flu. Because these patients are immunocompromised, they're at further risk for other complications, especially when they have the flu. And so the guidelines do recommend that these patients do get Tamiflu after 48 hours. But the recommendation for before 48 hours, that's typically for the normal, healthy patient who does not have any of these certain medical conditions in which causes their immune system to be compromised. There is some controversy over Tamiflu, and I know that might sound funny that in healthcare there's some controversy, because you guys probably think it's just black and white, but actually it's a lot of gray area. So the controversy in regards to Tamiflu is that it's a medicine that works the same way whether it's last year or next year. And why am I bringing this up? Because the flu specifically, or the flu virus, it mutates or changes every year. So if the virus changes every year, but Tamiflu stays the same, is it still effective? Because that's why we get flu shots every year to cover that year's flu virus, hopefully. And I made a video about the flu vaccine, and I'll put in the link in the description below so you guys can check that out. But in regards to Tamiflu doesn't change. And so is it actually effective in treating the flu? Because what if the flu virus mutated in a way that it doesn't really use neuraminidase enzyme, or use another way to replicate, but Tamiflu is just using the same method of trying to help treat or prevent the flu? Now, this is a controversy I've heard, and I want to know if you guys have either heard about this in the comment section below, let me know, or if you haven't heard about this, as well as any insights or any perspectives you guys have about this topic. I would love to hear you guys' comments, and we can maybe have an open discussion about this. So those are the recommendations for Tamiflu and how it works. I really hope you guys enjoy this video. Please subscribe to my channel. My goal is to get to 1,000 subscribers by May 2020. So make sure to subscribe to my channel and share it with your friends. Let me know if you have any questions or in the comment section below, or any feedback you guys have for me. I always read the comments. And thanks for watching. See you guys next time.